Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Metoprolol. Its brand name is Lopresor. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Metoprolol is a beta-adrenergic receptor blocker. It has selective activity for beta-1 adrenoreceptors, mainly located in cardiac muscle. At higher doses, metoprolol also has affinity for beta-2 adrenoreceptors of bronchial and vascular smooth muscle. In terms of indications for use, metoprolol is indicated to be used in the treatment of hypertension or high blood pressure, and it can also be used to treat angina pectoris as well as congestive heart failure. Before somebody was to use metoprolol, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. This medication cannot be used by patients who have cardiogenic shock. Patients with decompensated cardiac failure cannot use metoprolol. If patients have a hypersensitivity to metoprolol or any other component of the product, they would not be able to use this medication. It cannot be used in patients who have second or third degree heart block. It would also be contraindicated in severe bradycardia, and would also not be able to be used in patients who have sick sinus rhythm without the installation of a permanent pacemaker. In terms of precautions, it should be noted that heart failure symptoms may worsen during dose increases of metoprolol. Metoprolol may cause or aggravate arterial insufficiency in patients with peripheral vascular disease. If metoprolol is used by patients that have diabetes, there's a chance that the medication may mask tachycardia that could happen during instances of hypoglycemia or low blood sugar. It could also mask clinical signs of hyperthyroidism, which would be, again, tachycardia. Dosage adjustments may be necessary, and monitoring would be recommended in patients who use this medication who have hepatic impairment. And it's not recommended to use this medication in patients who have bronchospasmic diseases unless they're unable to use other blood pressure lowering agents. Abrupt discontinuation in patients who have thyroid toxicosis could lead to a thyroid storm. And lastly, for precautions, this medication should be titrated slowly when coming off of the medication rather than stopping it abruptly. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use metoprolol, more often than not, they can expect to take their dose in oral form. When treating hypertension or high blood pressure, patients can expect an initial dose of 25 to 100 milligrams taken once daily. The dose would then be increased weekly or in longer intervals based on antihypertensive or anti-high blood pressure effects. Typically, you would not exceed doses over 400 milligrams daily. In angina pectoris, or chest pain, typically 100 milligrams would be given initially, and then the dose would be increased again in weekly intervals or longer based on symptomatic relief. Following a myocardial infarction or heart attack, a patient may expect to receive 25 to 50 milligrams every 6 to 12 hours, and then after 2 to 3 days, the dose may be increased to about 200 milligrams as tolerated. As with all medications, there are some side effects or adverse reactions that patients may experience while using metoprolol, so I'll go over some of those here now. Bradyarrhythmias may happen greater than 2% of the time. Some patients may experience hypotension or low blood pressure. Some patients may experience a rash while using metoprolol. Diarrhea, dizziness, depression, difficulty breathing, and fatigue all seem to happen greater than 2% of the time as well. Now, some more serious side effects would be arterial insufficiency, heart failure exacerbation, hyperthyroidism, hypoglycemia, and finally withdrawal symptoms upon discontinuation. That's all we're going to talk about today with metoprolol or Lopresor. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.